Hello, this is Jim Sove doing a YouTube video for distance learning on is my diabetes related to why I have to be on dialysis. First of all, if YouTube is listening, this is a homework assignment, so please don't delete my video. As you can see, my patient today is North Korean leader Kim Jong-un, and he has just been diagnosed with needing a AV fistula for dialysis treatment, and he wanted to know if the reason his kidneys are shutting down are related to his diagnosis earlier of type 1 diabetes. The question he asked me is my diabetes related to my dialysis treatment? My answer as a nurse would be yes, unfortunately, it is. Um, di- um, what is it called? Diabetes has a couple problems. Some of the problems could be microvascular, macrovascular, could be neuropathy pain. You could have ocular problems with your eyes, like blurred vision, or in this case, you could have nephropathy related to your kidneys. That is mostly related to vascular issues, which I related earlier. The diabetes kind of it doesn't attack, but it disrupts your vascular system, and your kidneys rely very heavily on your vascular system to the point that if they are altered at all through, let's say, diabetes, they will not perform as well as they could have. So, as a result, the performance that ideally you want to see in the 90% to 100% range will fall dramatically if you do not maintain your health in a diabetic lifestyle from keeping a normal insulin or glycemic range. So if you constantly have hyperglycemia because you're not following your insulin regimen, you could have vascular issues that could affect your kidneys, that could shut them down and can lead to vascular issues. The issues then could lead to dialysis, which would require an AV fistula, which would be a surgical intervention on your non-dominant hand, which would connect a artery and vein on your forearm, which would be the access site for your dialysis machine when you are getting dialysis done about every 3 or 4 days. So the best way to prevent that would be to follow a proper medical regimen, insulin therapy, as prescribed for your doctor and as followed with your nurse if you have any questions. Best way to do that is to have a blood glucose test done through a glucometer every morning before you eat breakfast, and done again, depending on how severe your type 1 diabetes is, before every meal. And based on your glucometer readings, you'll want to eat breakfast first, but then you want to, based on your sliding scale, take the amount of insulin you need. Sometimes you'll need to combine the insulin with a long-lasting insulin as well as regular insulin. Sometimes you just need to take one insulin drug. Some things you need to look for out for is if you miss a meal, you could become hypoglycemic. If you don't follow your diet, you could become hypoglycemic. If you exercise heavily, you could potentially become hypoglycemic. All those could lead to alterations in your health that could have lasting effects if you don't fix the problem immediately. That could lead to severe kidney problems that could lead to dialysis. So, to answer the Kim Jong Un's question of am I having dialysis treatment done because of my diabetes? My answer to that would be yes, you are. If you had followed, not to be condescending or judgmental, but if you had followed a normal insulin therapy regimen, this could have been prevented. Not always, but it could have, or at least it could have been delayed for longer. If you don't follow a thing like that, your kidneys will shut down faster and your health will deteriorate faster, and you could have longer lasting effects such as amputation of the feet. You could go blurred vision or blind, like your glasses, You could have a stroke from vascular issues in your brain. You could have pain, or actually lack of pain, like a numb tingling sensation in your extremities. But long story short, if you follow insulin therapy and the blood glucose testing every day, you should be able to follow a healthy lifestyle, and you could delay or prevent needing dialysis treatment done. Hope this was done, and I hope YouTube doesn't delete this video. Thank you.